Students, welcome back. Now we are going to see the dynamic stabilization of glenohumeral joint. In this, the first one is the deltoid contribution. Deltoid contribution in the glenohumeral joint. Okay, as we know that the deltoid is having three fibers. One is the anterior fibers, middle fibers, and the posterior fibers. Okay, that means it is having three segments. The deltoid muscle is having three segments. As we know that, and this deltoid is generally accepted that this muscle is a prime mover. Deltoid muscle is a prime mover along with the supraspinatus muscle, for glenohumeral abduction. Glenohumeral abduction. The deltoid is a prime mover along with the supraspinatus for glenohumeral abduction. And also the anterior fibers of the deltoid is also considered as the prime mover. So the anterior, so this is the posterior aspect. So the anterior fibers of the deltoid is considered as the prime mover in the glenohumeral flexion. Okay, that means both abduction and flexion or elevation activities with many biomechanical similarities. Both the movements, that is arm abduction as well as the flexion, both the movements of arm elevation is having some biomechanical similarities. So I have already mentioned that in the previous videos, that is the glenohumeral motions. So both during arm elevation, either it may be abduction or elevation, so both will demonstrate the lateral rotation. During abduction, also it is showing a lateral rotation. During elevation and during flexion also, it is demonstrating the lateral rotation to increase the range of motion. Okay, so based on that, these two elevation activities will have many biomechanical similarities. Okay, and the segment or segments of the deltoid, that participate in elevation will vary with role and function. That means the anterior fibers of the deltoid participate in the flexion of the arm, and middle fibers of the deltoid participate in the abduction. Okay, so that means though it is same muscle, but the segments of this muscle is going to be vary in role and its function. So depending upon the fibers involvement, depending upon the fibers recruited in any action, shows the activity of that particular lever. Okay, if anterior fibers are recruited, then flexion of the arm is done. If the middle fibers of the deltoid is recruited, then what will happen? Abduction of the arm takes place. For example, posterior fibers, so it helps in extension. So like that, each segment, the involvement of each segment shows its role and function. Okay, however, as we know that if you see the examination of the resultant line of action of the deltoid muscle in the abduction is used to study the dynamic stabilization of the humeral joint here. Okay, so, and if you see in this pic, so this one is the resultant deltoid resultant force. So this action line is formed by the force vectors of the three segments. Force vectors of all the three segments gives this resultant deltoid. Okay, so now this, when this muscle force vector is resolved, so now we are going to resolute this force into translatory component and the rotatory component. Okay, so this one is the fx, this is the translatory component which is passing through towards the joint, and this is the rotatory component which is acting perpendicular to the action line. Now, so this one, if you see these two forces, that is parallel force and the perpendicular force, Fx is the parallel force and Fy is the perpendicular force, and this Fx is acts as a translatory force and Fy is the rotatory component of this resultant deltoid force. Okay, now if you say this, in this the translatory component is greater than the rotatory component. Translatory component is greater than the rotatory component. Okay, so here this translatory component, normally what we see, if the translatory component normally causes, either it may cause compressive force or a distractive force. Compressive or distraction force causes by this translatory force. But in this, what will happen? Here if you see this parallel component, this parallel component is parallel to the shaft of the humerus, but the glenoid fossa and the shaft of the humerus is not in a line. So it is not in a line here. So what will happen? So normally in any joint, so for example, if glenoid fossa is present here and this one, for example, in any joint, so this another articular surfaces is present, then it is in line. Okay, so otherwise, so if we can see in this only, if you take this and this abduction, so 90 degrees of abduction of the shoulder, okay, then the head of the humerus and the glenoid fossa in line. But when the arm is present on the side, when the arm is present on the side, the glenoid fossa and the humeral head is not in the line. Okay, have you observed this? So the glenoid fossa and the head of the humerus is not in the line. But the translatory force, which is greater than the rotatory component, which is parallel to the shaft of the humerus, that is the long axis of the shaft of the humerus, this force is not giving any compressive effect. This force, this translatory force, which is resolved here, is not creating any compressive effect, but it causes some shear force. It causes some shear force. So because, yes, this, what is this force? Here this force is greater and this force has to apply on this. So normally it has to compress. Here there is no chance of compressing this head of the humerus in the towards the glenoid cavity because they are not in line. So there is no cause of compressive force. So because this force is acting like that, so what is this force is doing on this humeral head? So this humeral head, So this force is creating shear force on the humeral head, which causes, that means shear means which causes some movement, is called shear force. So what is happening? Because of this force, the humeral head, so the force is towards superiorly, so the humeral head will glide superiorly. The humeral head will glide superiorly. So in the arthrokinematics, what we have seen, initially the humeral head is gliding superiorly. Now how it happens there we can't see, we can't explain it. Only the intra-articulations we have seen in the previous session. Now how it is happening here, this is the way of superior gliding of the head of the humerus causes by the translatory component of the resultant force of the deltoid muscle. Okay, so this force causes the superior gliding. So this force causes superior gliding, then what will happen? So this humeral head will glide upwards and which touches the coracoacromial arch. In between the structures also there is some sort of impinging the structures in between them also. Okay, so this force, when it touches the coracoacromial arch, the coracoacromial arch is creating the reaction force. This is theoretically creating the reaction force on the humeral head causes the inferior gliding motion. Okay, so by causing the inferior gliding motion, there is an increase of range of motion taking place. So but here this force is causing the superior gliding. So now we will see the rotatory component. So this is very small actually when compared to the translatory force. So this has to occur. If this rotation has to occur, how it can occur? When this translatory force should be in equilibrium. So this force has to be the translatory force has to be balanced by other forces. Can you imagine what are the other forces which can cause the equilibrium? So by the side hanging of the arm, we'll have another force acting on it is the first force in any object is the gravitational force. But here the gravitational force is not sufficient. The gravitational force which is acting on this is not sufficient to maintain this translatory force in equilibrium. If it is maintaining equilibrium, then there is no chance of superior gliding will takes place. So the gravitational force is not enough to balance the translatory force. Then what is the other factors which cause this equilibrium? So here what will happen here is for the stabilization of this translatory component, it requires other muscle forces. To maintain stabilization. That muscle forces are nothing but the rotator cuff muscles. The rotator cuff muscles helps in the stabilization of the glenohumeral joint occurs. Okay, so that means the deltoid muscle itself is not having a capacity to stabilize the glenohumeral joint during motion. It requires other muscle forces to maintain the stabilization, dynamic stabilization of the glenohumeral joint. That one is taken up by the rotator cuff muscles. So this deltoid here the stabilizing effect is not that much present, because it is causing some shear forces which is causing superior gliding of the humerus. So this force is not enough to stabilize, because this force is causing some shear forces. So to stabilize this component, the other muscular forces are required to get dynamic stabilization of the glenohumeral joint. So this is about the contribution of the deltoid muscle in the dynamic stabilization of the glenohumeral joint. And because if this force is not stabilized, there is no rotation, there is no abduction takes place. Okay, so though it is a very small rotatory component, this force is not enough to overcome this force. So what happens to this force? This force is going to add up with the other muscles. Other muscles momentum causes greater range of motion. Okay, that means along with supraspinatus, it causes greater range of motion. Okay, so how supraspinate, as we know that supraspinatus helps in the initial range of abduction. Now here comes up to 15 degrees how this supraspinatus muscle is going to act, and how this component is stabilized by the other muscular forces to cause greater range of abduction. Okay, now deltoid has a very limited stabilization, dynamic stabilization of the glenohumeral joint, but it causes the shear force to cause superior gliding of the humeral head. Okay, so this is about the contribution of the deltoid muscle in the glenohumeral stabilization. In the next session, we are going to see how these rotator cuff muscles are used in glenohumeral dynamic stabilization. Thank you.